Hi, I'm Dr. Roger Herchak. It's a pleasure to be with you today, and I'm really excited about introducing one of our new physician providers. Often I get called at the medical center, we just don't have enough staff. Well, surprise, we've got staff, and we've got wonderful staff. I'm going to take the opportunity to introduce Dr. Rebecca Kimple that we were blessed to get from actually the state of Pennsylvania. Dr. Kimple and I got to know each other about 2.5, 3 years ago through an introduction through the church. And Dr. Kimple and I have been talking for quite some time, and finally, after about 3 years, we were able to get Dr. Kimple down here, staff full-time in the medical center. So with that, I would like you to meet Dr. Kimple. And Rebecca, how long have you been with us now?
It's been 4 months.
4 months. Okay, that's great. 4 wonderful months.
It's been great.
It's been
went
great.
Really quickly.
Good, good. And your role is specifically?
The clinic staff, outpatient doc.
Good, good. So you're one of the 3 physicians and 2 nurse practitioners that work in the center. Great. And could you tell us a little bit about your background, the state you came from, some of the things you were doing before your board certification, Rebecca?
Okay. I'm a Pennsylvania girl. It's amazing that I'm here and I'm loving it, but sorry, Mom. I grew up in western Pennsylvania, north of Pittsburgh. Elwood City is my town. And then I went to school in Philadelphia at Hahnemann. Did my internship up in Dartmouth Mary Hitchcock Medical Center, and finished up at Robert Packer Hospital in Sayre, Pennsylvania. And then I was out in Pittsburgh for a few years in private practice, then moved out back to Bradford County, Sayre area. I did some emergency room work for a number of years, and some cardiac stress testing, and a number of years at the Wilkes-Barre VA. I managed the CLC and an outpatient program there. And most recently, I've worked at a Pennsylvania state facility for the intellectually disabled, a residential facility, so before coming here.
Dr. Kimble, have you always desired to be a physician?
Since about age 7.
Wow. And what led you in that direction, or what gave you the motive to keep going on to become one?
My mother really appreciated the family doctor that we had growing up, and she just was, in a family that they didn't have insurance, and he just went out of his way to accommodate what our family's needs were, and that impressed me a lot. So.
And do you have a special place in your heart for geriatric care or senior care?
I do.
Because all of our residents, when they leave and they've been seen by you, they look like they've been touched in a very special way. So you must have that gift. So,
I mean, not everyone is what I'd consider very old here. A lot of young and youthful people, even the older aged ones, are many very healthy people. So that's a great thing to work with too. But I'd like to think of people as my own family, how would they want to be treated. I hope I can do that.
Yeah. What a wonderful way to go, Dr. Kimple, to look at each person as, that is my family member, and that's the way I'm going to treat them. So that's what makes you so special. So thank you.
You're welcome. Thank you.
And now, what is your passion? You've got a couple passions, Dr. Kimple. Could you tell me a little bit about your passion, other than for wonderful patient care? Because you have been here 4 months, and I've just gotten so many wonderful calls from residents that I'm absolutely thrilled with your care.
Well, people are very kind. What my hobbies and type things are. I love to travel.
Okay.
And that works out very well with my husband because he travels a lot.
Could you tell us really quickly about your husband?
My husband is a musician. Yeah. And he travels. He's on tour now for the summer. He's with the King's Brass, and he's been doing that for 39 years. He's came to Shell Point for probably 25 years. So he's watched the whole facility grow from the island to expanding outward, and he just loves it here. So he always tries to bring the group down, and when I would come down, when he was down here with the group, I just fell in love with the place and loved the mode of care, the method of care.
Good.
So
Wonderful.
it was a difficult decision of whether to come to retire or to come to work. So.
Well, and I know it was because I bothered you for about 2.5 years trying to get you to come to Florida, and I think I finally said, why don't you take your boards if you're really serious? And you did take your Florida boards from Pennsylvania, and you passed them, which is wonderful. The first great step.
The Florida licensure, we worked ahead on that, so that was probably pretty good thinking.
Great.
So
Great.
worked out
And
well.
we're so glad that you're here. And obviously, you have some capacity in your practice to see more people. So I certainly hope that our audience knows that you call the medical center at any time and set up an appointment to see Dr. Kimple. She does the full gamut of primary internal medicine, and I know you'll be thrilled with her services and blessed by her care.